You're watching Medical News Network, your trusted source for the latest in medical news and information. I'm Mike Wittgenstein. Today we look into the world of dental veneers. What are they? How do they work? And who are they for? We'll also take a look at a new phenomenon in dental care, the dental facelift. So if you are unhappy with your smile, have teeth that are worn down or discolored, or would just like to be better informed, then this is for you. Stick around, it's going to get interesting. We'll be right back.
Welcome to an educational and comprehensive discussion with today's top medical experts. This is your trusted source for the latest in medical news and information. You're watching Medical News Network.
Welcome back. We are very pleased to have as our guest today Dr. Sam Muslin, who is the recognized leader in cosmetic dentistry and dental facelifts in the Los Angeles area. Dr. Muslin is a member of the American Dental Association, the Academy of Laser Dentistry, the Academy of Implant Dentistry, and the Academy of Computerized Dentistry. He is a graduate of the prestigious Scripps Dental Implant Institute and is a diplomat of the American Board of Forensic Medicine. Dr. Muslin is one of only a handful of dentists in the last 50 years to become a master of the Academy of General Dentistry. Dr. Muslin, welcome to the show.
Thank you.
Dr. Muslin, I invited you on the show today to talk about veneers. What are they? What can be done with them? And what's new with veneers over the last 10, 15 years. But before we get into that, you're a master of the Academy of General Dentistry. And I really had no idea what that was till I did a little research on it. Why don't you tell me exactly what's involved in becoming a master and why so very few dentists are?
Well, a dentist that becomes a master is somebody that has just dedicated themselves towards continuing education, way beyond dental school, way beyond the state licensing requirements. It's a dentist that really enjoys what he's doing or she and works extremely hard at getting advanced education.
In the last 50 years, there have been 1,300 dentists in this country that have qualified as a master. I mean, that's almost a minute amount. Why do you think so few dentists have taken the time to become one?
It takes an extreme amount of time to do it. You are taking classes constantly, you're being updated on the latest technologies, you're developing the latest techniques, you're sometimes working with equipment that has not been completely proven yet, and so you have the ability to be on the absolute cutting edge of dentistry today.
Do you think, it's about, if I'm not mistaken here, it's about 26 weeks, the equivalent of 26 weeks of day after day schooling to become it. Do you think that just very few people are willing to put that time and effort in?
Well, when you're a dentist, if you're a female dentist, you may be married, you may have kids, it becomes difficult to dedicate that amount of time. Or a male dentist sometimes may prefer doing other things. You really have to be willing to dedicate yourself to the profession.
Do you think becoming a master has helped you in your dental practice?
It's helped my patients enormously. You had to become a fellow of the Academy of General Dentistry first, and you had to pass a proficiency exam that takes about 4 hours. And so once you've completed that and received the honor of fellow, then you start working on your master. The average person working on their master takes at least 10 years to accomplish it.
Well, it's a very incredible thing, and I commend you on having achieved it.
Thank you.
Let's talk about veneers.
Okay.
First of all, just so everybody knows, what are veneers?
A veneer is a very thin shell of enamel that fits over the surface of your tooth. It's custom made, it has color, it has texture, and it is designed to accomplish either changing the shape of your tooth or changing the color of your teeth or doing both. Some instances lengthening your teeth, sometimes making crooked teeth look straight. A veneer is an incredible advancement in cosmetic dentistry.
Can everybody have veneers? Is there anybody that can't use veneers to accomplish what they're looking for?
Everybody can have veneers. It's just that young people that have not had all of their teeth come in, they haven't erupted yet, should not have veneers until their teeth are fully erupted.
So the veneer can't grow as a tooth grows?
No. A veneer is a stagnant piece of porcelain that will always stay the same.
Okay, when you put them in, is it painful?
No, it's not painful at all. Some people need to be anesthetized. Other people have the latest development, which is a no preparation veneer. Your teeth don't have to be ground on.
I read that. Now,
Yes.
I have not talked to anybody, and I talked to dentists all across the country, that has ever spoke of a no prep veneer. You're telling me you don't have, because normally don't they grind down your teeth?
They normally do grind down your teeth, and you'll see in some of the cases we're going to present later on in the program that that the teeth do not have to be ground on at all in the right circumstance.
So you can put the veneer right on the tooth.
You can take an impression, send it to the ceramist. The ceramist will custom make the veneer, and then we fuse bond the veneer right to the enamel. In fact, a no preparation veneer is bonded stronger than when you grind the enamel off.
Then why don't the majority of dentists do it that way?
I think more and more dentists are going to begin doing it that way. And
Is it more difficult?
It's a lot more difficult. And I think more of the labs are beginning to offer it. It will become big.
Okay. Question for you, because I know as a master, what is required, what kind of training do you have to be licensed to put in veneers, or do you have to have any?
You don't have to have any training. Any dentist, a general dentist that feels he himself or she is qualified to put in veneers is allowed to do so.
Whether they're qualified or not?
Well, you have to learn. You have to start somewhere.
And do you think, is there a learning curve? Do you get better as you do more and more veneers?
There's a huge learning curve on doing veneers from an artistic standpoint. Some of the dentists you'll see in the early work when veneers were first being developed, they looked bulky, they looked fake.
But the big horse tooth.
The big horse tooth, they were too long, they broke off, teeth were sensitive to hot and cold. And today, the sensitivity's almost completely gone, and
How many veneers have you done?
I've done veneers for, let's say, 20 years. I'm guessing thousands.
And you think you get better as you go through them?
You get a lot better, and basically because every patient is different. Every patient has different needs. And so veneers are not the same for you than what they would be for somebody else.
I was just going to ask you, is the standard practice pretty, I mean, is it pretty standard through all the dentists? Does everybody do it about the same?
No, dentists are all using different bonding materials. They're using different cements. There are so many products being offered on the market today. Some work, some don't. It becomes really tough if you're the dentist to pick the right technique that will work, that will last, that will look good.
Okay, before we take a look at the photos, and I want to get to them pretty quick because
Okay.
they're very impressive from the ones I've seen.
Okay.
What should somebody ask if they go to their dentist, they're thinking about having veneers done? What should they find out about that dentist prior to committing to having him do the veneers for them?
I'd like to know if that dentist was a member of the Academy of General Dentistry, because putting on veneers requires a lot more knowledge than just veneers. You need to understand bites, you need to understand occlusion, you need to understand a lot of things about dentistry. I think that if that member is a fellow, that shows he's reached a very, very high level, and if you're fortunate enough to find a master, then I believe that you have reached the pinnacle of the profession.
I can't disagree with you. All right, we're going to take a look at the photos. The first photo, tell me a little bit about the gentleman. He's about how old?
The gentleman at the time these were done is approximately 19 to 20 years old.
Okay, let's take a look at him.
Okay.
All right. He has a pretty nice smile. I mean, the teeth look a little big in the front, and the eye teeth look a little long.
He's a handsome young man, and basically when you're looking at it, it looks like his front two teeth are too large, but in fact they are not. Only 2 teeth were treated in his entire treatment.
Okay, and if we bring up his after picture, wow, that's a huge difference. Now, you telling me you did all of that with just 2 veneers?
That's correct. We whitened him first. We used my whitening technique that I've sort of perfected to a certain degree, and we got his teeth nice and white first.
Okay.
We wanted to develop the color, and then we did 2 veneers and matched the color to the rest of his teeth.
All right, let's put the before and after up next to each other real quick. Wow, I mean, it makes a tremendous difference. He looks like a young, goofy kid on the left. I hate to say that, but on the right, he looks like a graduate of college.
When you straighten out a smile like that, it makes the person look smarter.
All right, let's move on to the second one here. Now, let's bring up her before real quick. All right, young girl, nice smile, a little spacey in the teeth.
Yes.
And you did this one with?
This was done about 7 years ago, and it was done with no grinding on her teeth at all. No shots, no grinding. We put porcelain veneers on her existing
All right,
teeth.
let's bring up her after photo.